Hello, everyone. I'm Randy Murphy, epidemiologist and director of disease surveillance here at the Mobile County Health Department. Here on January 6th to give you our update on the impact of the COVID-19 pandemic on Mobile County, our workforce, our visitors, our businesses, ourselves. So yesterday, 1,005 cases were reported among Mobile County residents, bringing our cumulative count to 84,405. We had 0 deaths reported to us yesterday, yay, and 41 additional people were hospitalized with COVID or in the hospital and diagnosed with COVID, bringing the number to 9,597. Not going to be long until we hit more than 10,000 people hospitalized with COVID at this rate. Before I go any further, I just want to mention we're going to have a slightly shorter Facebook Live today, have a really important national call with the Centers for Disease Control at 2:45, and so I really need to be on that call. They're going to try to provide some clarification on the shortened guidelines for quarantine and isolation, and it has caused much confusion, so I really want to participate in that so that I can make sure that I'm clear so that I can provide appropriate guidance to other people. So yesterday, 160 people were hospitalized with COVID-19. That, on Christmas Day, we had 22 people hospitalized, and here it's just, not even 2 weeks later, and we have 160 people hospitalized. So an 800 and some fold increase in the number of people hospitalized. I've gotten a lot of questions as to, people saying, like, why are you making such a big deal out of this? Like, why are you trying to scare people? We don't try to frighten people. I try to just provide information and interpret guidance and, empower people to protect themselves. But based on some of this feedback, I wanted just to give a little bit information on the severity of illness. We've CDC has sort of, published some information to show that, based on preliminary data, of course, but it's better than no data, that you usually get sick faster with Omicron, so you'll probably get sick within 2 to 3 days if you're exposed. It is thought that, you will maybe clear the infection sooner, that Omicron is less severe, it is more highly infectious, 3 times more infectious than Delta. So we know that there will be less severe illness. What I have been saying is that, yes, that is true, and we're very happy for that. But when you have 10 times or 100 times or, more infections than with previous viruses, you're liable to have just as many hospitalizations potentially. So it's just a volume numbers. But I did put together, Tommy helped me put together this graphic in this direction somewhere up here. And it just shows really the Delta wave, which was during August and September. In gray are the number of cases. In, I think, orange, is that right, are the number of hospitalizations. And then the number of deaths are in green. So you can see during the Delta wave, the number of hospitalizations was much higher than we're seeing right now. But remember, hospitalizations peak about 10 days after the peak of the number of cases. And then deaths, shown in green on this chart, peak 10 days or so after the peak of hospitalization. So if this pattern is true for our current wave, our Omicron wave, we may not see, or we probably are not going to see, the full impact on hospitalizations and deaths until we are past our peak of Omicron cases. So I just wanted to comment on that, just to try to sort of put that in perspective. You can see on the far right-hand side where we're showing the Omicron wave, the number of cases far exceeds what we saw during the Delta wave, but the number of hospitalizations right now are quite low compared to what we saw during the Delta wave. Still, if your family member is one of those 160 that is hospitalized in Mobile right now, it's probably just as concerning to you now as it was in the Delta wave. So when we look at the data for people who've been in the hospital in the last 14 days with Omicron, the average length of stay is shorter. That's really good news. So the average length of stay is 6 days. the average number of days in intensive care, and just, a much smaller number of people are requiring intensive care, and the duration is shorter. So days in ICU is 2 days. And then even those that are in ICU, a smaller number of them require mechanical ventilation, and the average numbers of days on a ventilator is just 1. So this is all really good news. I think the thing that I'd like to highlight about people who've been hospitalized in the last 14 days is that 15% of them were less than 18. So this is a bit of a shift from what we've seen previously, in that those younger age groups are the ones that right now have the lowest vaccination rates, partly because they weren't eligible for vaccine until recently. They weren't eligible as early as adults were. Also because there has, maybe been low uptake in families to vaccinate their children. So just to know that at least in the last 14 days, 15% of the people hospitalized were less than 18. And among those hospitalized, the proportion that are unvaccinated is still pretty high. It's still the majority of patients. So right now we're seeing about 2/3 of people in the hospital are vaccinated, and about 2/3 of people are unvaccinated, and about 1/3 are vaccinated. So that again is different now than we saw during Delta, where 90% of the people who were infected with Delta were unvaccinated. I've gotten a lot of questions, and I've been challenged on this. Like, you keep saying that, a vaccination stops infection, and that obviously is not true, because people who are getting vaccinated are still getting infected. And we've never said that vaccines work 100%. We know that they don't, right? So yes, vaccines will slow the spread, because it will, having a robust immune system, being vaccinated and boosted, will stop some people from getting infected. But as a whole, it will slow transmission in our community. So again, just want to clarify that. We know that people get COVID that are vaccinated. We knew this when the vaccines first came out, that this would happen. But when you have, 1/3 to 50% of people testing positive, when community transmission is so high, the highest now than it's ever been, we know we're going to see a lot more infections in vaccinated people. Our opportunity to sort of squash the outbreak altogether has long passed, because now we're seeing Delta variant and Omicron variant, and who knows what else we'll see. So it's unlikely that the hopes of extinguishing the SARS-CoV-2 transmission with, a worldwide uptake of a very safe and effective vaccine, those dreams are not going to come true. And we're left with the reality that we have a safe and effective vaccine. Those who are fully vaccinated and boosted are going to benefit from having some protection against infection, and should have a less severe course of illness. But again, the highly infectious nature of Omicron, and the very, very high level, the record level of infections in Mobile County, we're going to continue to see breakthrough cases. Interestingly, of the children that were hospitalized, there's not I said about 15%, so we're talking about 13 children in the last 14 days. All of them were unvaccinated. Okay, just a couple of things to mention. Infirmary Health posted that they have begun, let me just read their statement so I'll get it right. So Infirmary Health, in an effort to keep our community safe and informed, Infirmary Health will resume sharing daily statistics and information as it relates to COVID-19 across our system. Our communities are experiencing a 5th surge of COVID-19 with the Omicron variant. We strongly encourage you and your loved ones to remain vigilant, get vaccinated, wash your hands, and wear a mask. We are all in this together. Infirmary Health, and this was Tuesday, Infirmary Health currently has 88 COVID inpatients in its hospitals. And there's some more on this that's chopped off, but I think you can go to their website. And when they say their hospitals, they're talking about Mobile and Baldwin County hospitals. So you can go to Infirmary Health and keep an eye on hospitalizations and information on hospitalized patients in those hospitals if you're interested. Also wanted to mention that boosters are now eligible for people 12 years and over. This is a Pfizer booster available for 12 years and over. And a third Pfizer shot is authorized for immunocompromised children aged 5 to 11. Go into more detail about that. I want to talk a little bit about the shortened quarantine and isolation because it has caused confusion and just wreaked havoc throughout healthcare and public health and schools and everybody. Like, we are all confused about what CDC is trying to say or do about the shortened quarantine and isolation. And just a couple of statements to make from their the information that they posted on January 4th. You know, Omicron has a shorter incubation period, 2 to 4 days. I mentioned that already. The variant is 3 times more infectious than Delta. And shortening to 5 days for isolation, this again are people who are infected with Omicron. You know, shortening it to 5 days is an effort to, well, shortening isolation and quarantine. Let me just read this. The recommendations for shortening to 5 days and mask wear through day 10 reflect the social impact, for example, critical infrastructure and staffing shortages, and the latest science on disease severity and how and for how long a person is maximally infectious. There is some modeling out of the UK that say at 5 days, 2/3 of the people will no longer be infectious. But at 5 days, and again, this is modeling done in the UK, 1 out of every 3 people who discontinue isolation will still be infectious to others. So that is why it's important to continue wearing a mask. If you're going to follow the 5-day, the shortened quarantine, you need to continue wearing a well-fitted mask for the duration of at least 10 days. Also been confusion about who does the guidance apply to. And I'm just going to read this straight out of their information, their FAQ. The guidance applies to the general population in the community, including workplaces and K through 12 schools. So I think K starts at K3, K4, K5 through grade 12. So the guidance applies to general population, including workplaces and K through 12 schools. The guidance does not apply to healthcare settings, to correctional institutions, or homeless shelters. So congregate settings, healthcare, corrections, homeless, probably extend that even to group homes. The guidelines, the shortened quarantine and isolation to 5 days with mask wearing through day 10 does not apply to healthcare, corrections, and homeless shelters. It does apply to K through 12 settings. It also does not apply to children who are less than 2 or anyone who can't wear a mask. So masking is not recommended for children less than 2. If you have other reasons where you can't wear a mask, then you're not eligible to follow the shortened quarantine and isolation. I'll just stop there rather than continue on and make things more confusing. All right, here are some questions. Someone asking me to address the latest CDC guidance. Some people are confused over it. Yes, it is confusing. In general, if you are sick, stay home until you are feeling better and fever-free for at least 24 hours with all of your other symptoms improved. This is not new to us. If you're sick, stay home to keep from infecting other people. If you fall into some of those categories, general population, K through 12 schools, then you can consider shortening quarantine and isolation to 5 days, but continue to wear a mask for 10. But if you're in a healthcare setting, in a detention setting, a correctional facility, or if you're in a shelter, then those shortened guidelines do not apply to you. You need to continue following CDC guidance that's been around for quite some time now. All right. Somebody from the media asking me if I can address the latest and most important information that people need to know. So you need to know that COVID transmission is higher in Mobile County than it has been in any point of the outbreak, that Omicron infections are less severe, but we will still see hospitalizations and deaths from infection with the Omicron variant. So it's really important that you protect yourself by getting vaccinated, wearing a mask, distancing, washing your hands, staying home if you're sick. Someone asking about, again, we get lots of questions about, a little, I said, 1/3 of the people in Mobile hospitals are vaccinated. And we know people that are fully vaccinated and boosted are getting infection and requiring hospitalization. It is concerning, but again, we're optimistic that it looks like the hospital stays indicate that the illness is less severe and that duration of hospitalization is less than with previous variants. I spoke to one of my colleagues at a nursing home in Mobile earlier this week. They had just a terrible outbreak back in April of 2020, and I was really encouraged. They have a lot of cases now in staff, and several cases in staff and residents. And she said, no, this is not the same as we had before. Most of our residents are vaccinated, so they are mildly ill. This is not the hell that we lived when COVID-19 first came into our area and was just devastating to nursing homes. So I'm really encouraged that it does look like through data and analysis and anecdotes that the illness is more mild. Someone asking me if I know of the people in the hospital, what percentage of those in the hospital were admitted because of COVID or were admitted for something else and tested positive for COVID, and I don't know that information. Sorry. All right, here is a little bit more information. A few more questions. Someone asking if an employer can require an employee to work knowing the person is sick. And I don't know the answer to that question. I think it's a bad practice because you run the risk of shutting your entire business down if you let or require a sick employee work. And then if that employee transmits COVID or flu or RSV or any of the other common coronaviruses, you could have additional staff out. So it's, in my opinion, not a great business decision, but I think that I really can't speak to the legality of it. Maybe contact OSHA or maybe an employment attorney or an HR specialist. Someone said, I see where New Orleans has been handing out KN95s at their testing sites. Is there any way Mobile could do this? I've asked our Erin Coker, our emergency preparedness administrator, I've asked her if we have enough on hand that we might be able to do that, so stay tuned. She's going to check our inventory and see what our resources look like. Someone asking why we don't start the COVID case count over each year. This is sort of an epidemiologic phenomenon, right? So in epidemiology, when we respond to outbreaks and we're conducting surveillance for outbreaks, when we're in outbreak mode, we always count the number of cases that are associated with the outbreak. So these are known as outbreak cases. And if it's a potluck dinner that, at a church that there's an outbreak that just happens over a couple of days or maybe a few weeks, then the number of cases is counted the entire time. That's normally the way it goes. They're sort of contained within a calendar year. But for some things, this happens where we have an outbreak and the cases associated with that outbreak run over a calendar year. This is the same thing for the hepatitis A outbreak that we're in now. We had our first cases of hepatitis A, outbreak-associated hepatitis A in the fall of 2019, and we are still counting cases of hepatitis A that are attributable to that outbreak now, even longer than COVID. So This is just sort of the practice of epidemiology that when it's an outbreak setting, you continue to count cases until the outbreak is over. Now, that's going to lead to a question, when do you know the outbreak is over? And I think this is something that CDC and public health leaders and scientists across the U.S. are grappling with and trying to have some conversations around. I'm scheduled to participate in a call on Monday to discuss this very thing. When does a pandemic become an endemic? When is SARS-CoV-2, whatever the variant is, when is it endemic to our fabric, to our lives, and we just start treating it like influenza or one of the other, 4 coronaviruses that's cause the common cold every year. So stay tuned. I think over the next months, you may start seeing some conversations around that. How do we call the pandemic or the epidemic in the United States? How can we call it over? When does that happen? I don't think we're there yet, but maybe after the Omicron wave, we'll see. Let's see. Somebody asking about our current vaccination rates. So I checked just before coming in here. When we count out-of-state vaccinations, so include people, Alabama residents who got vaccinated in Alabama, and Alabama residents who may have gotten vaccinated in a neighboring state, it looks like we are at Mobile County is about 46% of its population is a fully vaccinated person. More than 50% have gotten vaccinated at least one shot. So that's good news that the majority of people have elected to set on a course to try to prevent or reduce transmission and prevent severe illness that might require hospitalization. Is a fever common with Omicron? I looked at some of our data based on, a rather small number of cases, but it looks like fever it was reported by less than half of the cases that we've spoken, the people who've had COVID-19 that we've spoken with over the last couple of weeks. Is it true that the rapid test does not show a positive result for Omicron? No, that is not true. The rapid test can detect Omicron. It may just not be 100% or 99% or 98% effective in detecting it. So you may have more false negatives. So what we tell people is if you are symptomatic with flu-like symptoms or COVID-like symptoms and you test negative on a rapid test, please get a PCR done. Because we want to, in that situation when we have high community transmission, you're symptomatic, or if you've been exposed, let's say someone in your household has COVID, if you test negative on a rapid, test by PCR or test again 3 to 5 days later when the virus has had more time to replicate in your body. All right, I think that's it, Mark. Any questions on?
No, but you got that call.
Okay. All right, we're going to call it a day.
We'll answer these next week.
Okay. Mark's saying that a couple of questions have come on Facebook today, so we'll try to answer those on Monday. Stay safe, everybody. Remember, the vaccine is your best tool for trying to, slow the spread of COVID and to prevent severe illness and hospitalization if you do get COVID. So please get vaccinated. Vaccinate your children. It's approved for 5 and older. And then if you are anywhere out in public, particularly at an indoor setting, we want everybody to wear a mask regardless of vaccine status, and distance yourself, and try to keep yourself safe when you're out in the community, because what we're seeing is if one member of the household gets it, everybody gets it, no matter how safe you try to be, and splitting your household into the sick and well. So stay safe, everyone, and we'll talk to you on Monday.